No, go. Good morning.
Good morning.
I know that face. It's been a long time since I've seen it, but my favorite friend is right here, and I'm very happy to see you this morning. Good morning.
Good morning, Carolyn.
How are you doing, Dr. Rosensweet?
Excellent.
Well, that's the best answer that anybody could get, isn't it?
Yeah,
And I am too. And I'm
good.
hoping, sorry?
No, go ahead.
Yeah, no, I'm just saying welcome, and I'm going to be welcoming up all of the ladies and men who will be coming up. Actually, next week I have a question from a man. How is that? Not
All right.
next week, in a few days. Yeah. So let us commence. Yes?
Yes.
Okay. Um, Question number one comes in having to do with one of our favorite subjects, progesterone. And this question is can oral progesterone cause anxiety in some people? I have heard that it can. Well, with others, it causes major depression. I'm very confused. Can you help?
Yeah. Um, in medicine, anything can happen. There are some core rules, they do matter. There's the most common things in almost any subject you can possibly name. And of course, there's the most common stuff that happens with progesterone, super common. And then there's variations. And then, even with progesterone or anything you can name, there's unusual reactions, things you wouldn't expect. I like to call them paradoxical responses. They're
Mm,
often the very opposite of what we would expect to see. And most common with progesterone is calmness and emotional well being. Oh, yeah. Progesterone is present in the female body in the second half of her cycle 200 times, I'm sorry, 100 times more prevalent than estrogen. There's 100 times more progesterone than there is estrogen. A woman's body loves progesterone. It comes out if a woman ovulates and when she ovulates, so it comes out mid cycle, just pours out and is present for the last 2 weeks. But because all these things are fat soluble, there's hormones that are in the fat that are stored in the fat as strategic reserve, and then once they're not being produced, they're available, they're out there. So it's not like 2 weeks of a cycle there's no progesterone. No,
right.
there is, but it's most robust during the second half of a healthy cycle, one in which a woman ovulates. If a woman doesn't ovulate, the progesterone is not there. And progesterone is very prevalent as it relates to mood. Many women in pregnancy, when progesterone levels just skyrocket, there's times during the day or during the pregnancy where they are super calm, like super
Right. Where you melt into whatever you're sitting on. Know that feeling.
super mellow. It's
Yeah.
not 100% universal, but progesterone is the great calmer. As I said many times, if I were to choose the right dose for you, Carolyn, or myself, and I were to inject the progesterone dose, that right dose, intravenously, we could be put to sleep so deep surgery could be performed on us. Progesterone's the great calmer. Therefore, when progesterone is not there, as occurs in the perimenopause, if not even earlier, progesterone is not there, the usual, most prevailing symptom is anxiety,
Right. Okay.
absence of calm, the great calmer.
Absence of calm. I like that. Yeah.
So there's many women who go into the perimenopause and they start developing an anxiety that doesn't quite make sense. Yes, life has challenges, and we can be nervous or concerned about various things that are going on and have emotions and be emotionally reactivity. But some of these women are totally surprised. They've never seen anxiety. They're used to the challenges of life. Absence of progesterone can go beyond anxiety. It can go into a woman feeling crazy. And we're on this Facebook Live today because of Deborah, who was a patient of mine in her mid-40s. I knew her really well. She stormed into my office, slammed her fist on my desk, and told me that, look, don't think you know me. I'm going crazy, and I mean it. Don't pretend this isn't just an ordinary visit with me. And then I gave her progesterone, and 3 weeks later, she was totally herself again.
Oops.
So progesterone is known as the great calmer. Now, when a woman says, and I'm finally getting around to what the questioner asked, can progesterone give you anxiety? Wasn't that how she languaged it?
Can oral progesterone cause anxiety?
Well, whenever you're dealing with any substance that you're taking, that you're being treated with, there's always a question, are you getting the right dose and the right balance? In 25 years of treating women in menopause with compounded bioidentical hormones, I have never seen a woman get anxiety from progesterone. That doesn't mean this isn't the first. And that's
Right.
why I led all this off with, yeah, you never say never in medicine. These paradoxical effects are definitely possible. Here's something that's common with progesterone is that a woman takes too much.
Mm-hmm.
And instead of getting calm, she gets over calm, otherwise known as depressed. Or she takes too much progesterone at night and she wakes up groggy as if she had taken an overdose of a sleeping pill.
Right.
These hormones are very powerful. Whenever they're administered, we want to get right in the optimal zone of not too much and not too little. And if we give too much, we're going to have trouble. It's not like these are side effects. These are effects of giving too much. So I don't know how to really answer that question without testing a woman, without really hearing her whole story, without knowing her balance. For a woman to get anxiety from progesterone, that'd be brand new. I mean, I can stretch my mind and can tell you that progesterone facilitates the action of thyroid hormone. And I could see if someone was borderline hyperthyroid, when she got progesterone and she wasn't used to having much progesterone in her body, maybe the thyroid could become more active. But it's a real stretch for me to say that. But here's what we do in every single case. We always give a woman an extensive questionnaire. There's 12 pages of the one that we give out in the menopause method. And from that, we learn so much about an individual woman that we get to follow the bouncing ball and figure it out. And from learning about a woman, for example, this woman who's asked the question, can I get anxiety from too much progesterone? We'll always get the first clues. Maybe the first clue for her would be stop the progesterone, see if the anxiety goes away, restart it, see if it returns. There's always the next step, is always something. But that would be what I would recommend to the questioner. Stop your progesterone. You can stop it cold. This isn't like taking a blood pressure medication or other seizure medication where you don't stop those things cold. You don't just go cold turkey on them.
Right.
Stopping hormones is not going to have that problem. That's not like stopping an important medication. You can stop a hormone cold. You're not even going to be taking yourself to zero because you've built up a strategic reserve in your fat tissue. So it's going to gradually come out, but then you'll empty yourself. But that is how you do the science project called "Is Progesterone Giving Me Anxiety?"
Got it.
And
Well,
there are some women who have special sensitivities to progesterone that aren't very rational, but that happens. So that's why I wanted to pause and really dig into this question. I would like to comment on someone has said, has asked, progesterone is causing me heartburn. Jody is commenting on that. And yes, it can. Progesterone is the great relaxer. One of its function, progestation, support of pregnancy. It does a zillion things like all these hormones do. And one of the things it does is it relaxes ligaments so that the ligaments that bind the pelvis together can even relax, and you can that pelvis can get a little bigger to pass the head of a baby in preparation of passing the head of a baby through there.
right.
Progesterone is the great relaxor. Relaxes ligaments and muscles. Relaxes ligaments in a pregnant woman in her back at a time when she's carrying some funky weight distributions there. So women in pregnancy can get backaches because they don't have the usual ligamentous support to handle the weight redistribution there.
Right.
And it can relax the lower esophageal sphincter, which closes off the esophagus to the stomach when you're not eating. And that with that relaxed sphincter, you get reflux. So you can get heartburn. Yep.
And well, what do you do?
Yeah, it's balance. It's a real balance. It's a dosage issue there. We always prefer to take progesterone at night because it can help, being the great relaxer that it is. It's so important to help women sleep, and women who get sleep disturbance. There's an estrogen deficiency cause of sleep disturbance. You get hot flashes in the middle of the night. And there's a progesterone cause of sleep disturbance. And we get very aggressive with progesterone when there's sleep disturbance because it has cured many a woman who's not sleeping. They're not sleeping. Give them progesterone in the right dose. They sleep. I mean, this is a big deal. True. This is a big deal. Some women more than others. But then if you take it at night and you're lying down, that's the time you do not want to get the lower esophageal sphincter relaxing.
It's a weird feeling.
Here's what you have to do. One remedy is that you want to be sure that you do not eat after 6 o'clock. No food. Because if you're eating into the evening, you want a couple hours, 3 hours at least, for the stomach digestive phase to be done. Not 3 hours in a young person, someone in their 20s or 30s, but as you grow into midlife, can take you longer to digest. And that digestive process in the stomach is going to call out hydrochloric acid, and that's the thing that refluxes. Right. So you don't want anything in the stomach when you're lying down and going to bed, when that lower esophageal sphincter is going to relax if you're on progesterone. You don't want anything in there. So you cannot eat after 6 o'clock at night, or you got to figure out when the last time you can eat. Maybe some of you could eat at 7, up until 7. Maybe some of you could eat up until 8. You'll figure it out. But if you're getting heartburn at night, one of the first things, the remedies to play with is eat earlier. Give that stomach enough time to totally do its thing, even if it needs 3, 4, 5 hours to do it. You wouldn't think it would. That's not what you're going to read in books. But you want to figure out what time is the latest I can eat so that when I lie down, I do not get heartburn. I do not get reflux.
That's a really good
That's a good place to start.
Absolutely. Yeah, it's a good point.
And then some women, they need the progesterone so much and they can't seem to take out that heartburn piece. There's these slanty pillows. They look like triangles. They elevate the head of your bed. They elevate you. Or you could put a couple, if you put 6 2x4s underneath the head of your bed, you're going to put your bed on a tilt. 6 2x4s is 6 inches. Well, wait, let me do the math there. 4 2x4s are 6 inches. A 2x4 is 1.5 inches, actually. Yes, 4 2x4s, excuse me. That's going to put the head of your bed, if you put it under the 2 posts, feet, the 2 feet at the head of your bed, you're going to be sleeping on an angle. And that can be a remedy for reflux because you're trying to balance being able to sleep, not getting reflux. So gravity, you don't want gravity to to move the stomach contents up into that esophagus. So there's some things. Go to iwonderdoctor.com. iwonderdoctor.com. We have a major section on digestion and reflux is in there and how to handle reflux.
Yeah, it's a great site. It's a great site. Absolutely.
Did you post that site, Carolyn?
Yes, and I actually do. From time to time, iwonderdoctor.com because boy, I sure honed into that for a good year and learned a lot. I will absolutely post that. Thank you for that answer. And Jody says thank you and welcoming everybody up here. I'm going to move on to question number 2, which really again, goes with number 1. I would love for Dr. R to speak to us about what a hot flash is actually, or what it actually is, and why it is that we have them.
Well, I think the general purpose of a hot flash is to put out a fire alarm in your body, and takes us down to the purpose of every single symptom or illness that has ever occurs in anybody. There's a purpose. Nature has a purpose in symptoms, in illness. It's part of a natural process. It's an attention getter. These symptoms and these illnesses are strong enough to grab our attention.
Oh.
And the purpose of that grab of our attention is to get us to ask a question. And this is the important question that is the next step when someone discovers an uncomfortable symptom or illness. Here's the question. What the heck is going on here?
That question. Silly me.
Now, the problem with this question is your body, as a representative of your total multidimensional being, capable of getting your attention, wants the correct answer.
Yeah.
It doesn't want some lame, partial answer. Oh, maybe this is a cold weather need. I've got to move to Alaska. I don't think that's exactly the thing. Or maybe this is a vitamin C deficiency. Nah, not enough connection there. It's not going to take some lame, or maybe I need to do a keto diet. No, it's not going to take some partial, inappropriate, incorrect answer. He wants the right answer. Here's the right answer. Take care of that menopause. Do the right thing. Go shopping for some healthcare provider that is specializing in treating women in menopause with compounded and bioidentical hormones. That is the right answer. It's
Yeah.
trying to let you know that something very significant is going on here.
Oh,
And
absolutely.
and it's life stopping. I mean, of course, women know this. There's women who are getting these hot flashes in the middle of the night. They're waking up and they're awake for a couple hours. It's like, it's serious. The good news is it in itself is not a disease and it's not going to harm you. That's the good news. But it is a strong signal, and and here's the only answer that your body is going to accept in the long run and the short run. Something huge is going on here. You're losing your ovarian hormones, 4 of them. And here's the right answer: replenish them as soon as you can get it right, and for the whole rest of your life. Like men, more and more commonly, are losing their ability to have an erection.
Mm-hmm.
This is very, very poignant for men. And that's quite a signal. And the very best thing that can happen is the men can address the many moving parts there, at the vanguard of which is testosterone diminishing. And losing that erection is a signal that's the same signal. What the heck is going on here?
Right.
And the answer is the same. Go find someone who can write a prescription for testosterone and is specializing in it, and go out there and get it and whatever else you need for
Right.
the rest of your life, because these hormones are so powerful that they affect everything. So men who lose their testosterone lose their drive, lose their libido, lose their mental acuity, lose their muscles. Why do older men need canes and walkers and wheelchairs? Why do older women need canes, then walkers, then wheelchairs? Because you lose your muscles without your testosterone. So when a man loses erection, there's much more at stake than his sexual life.
Right.
Brain
Right.
function, drive, aliveness. So many things are at stake.
Right. So when a woman has that hot flash in the middle of the night that jars her awake, and that saber-toothed tiger is outside, not really, but you sure think so, chances are
Yeah, that's
something's
not
up.
chances are. That is your thermometer, your signal that you are low in estrogen and you want to replenish estrogen. Now, what causes the hot flash? Well, I think the main thing is that low estrogen is stressful to a woman's body.
Yeah.
And it triggers the biology of the stress response. And one of the things, the biology of it is her surface skin blood vessels dilate. And you get the warm blood from the center of your body, because it's warmest there, shooting out to your skin. And you get all that warmth, and you think, oh my God, so who turned the fire on here? And so there's an accoutrement of the hot flash too, because it is so stressful. You get an outpouring of the stress hormones called adrenaline, for one thing. And if that adrenaline can get you a racing heart, racing mind, heart palpitations. The moral of the story is, if you're getting hot flashes day or night, do the right thing. Replenish those ovarian hormones. 75% of women in menopause get raucous, life-stopping symptoms. It's like any illness. The strategy of an illness, the natural process of an illness is always the same. Your body is trying to give you feedback that something's going on here, and it wants you to ask the question, what the heck is going on here? And it wants you to come up with the right answer.
Right.
And if you don't get it right, you're going to keep getting symptoms.
Right.
And having said that about hot flashes, I've told you what I think is the most important thing about them. They are there to stop your life and to get you to do the right thing. And the right thing is get excellent hormone replenishment. 75% of women get those hot flashes. 25% don't. 25%, they don't have a lot of symptoms in menopause, or they have none. And they look around at the women who are having all this ruckus about what's going on with menopause, and they go, what's wrong with them? They must be crazy. There's nothing wrong with menopause. I'm having natural menopause. That's the women I'm concerned about, because they also have almost total loss of estrogen, progesterone, testosterone, and DHEA. That means you almost write in yourself a written guarantee that you're going to get muscle loss. That means sooner or later, it may take you to your 70s or 80s, you're going to be in a cane, a walker, a wheelchair, assisted living facility, nursing home. When you lose the muscle that holds up the bladder and the uterus, it's part of the mechanism to get you into adult diapers. You'll get vaginal atrophy, you're going to get bone loss, you're going to get a much, much greater chance of getting arteriosclerosis. These are the profound consequences of the loss of these most powerful biochemicals in our body. So the short answer is hot flash, congratulations.
Yeah, I was just going to say it might be a really good thing in the weirdest of ways.
And don't stop till you get this one right.
Yeah.
You may not get it perfect, but you can do so much good for your body. Oh man, by getting as close to accurate as amount of estrogen, progesterone, testosterone. Women, testosterone is not a male hormone, it's a human hormone. You need your testosterone as much as men need we need our testosterone. So you need a very complete program. Never leaves out anything so crucial as testosterone and DHEA. No way. So hot flash, get thee to a healthcare provider. That's your job. Go shopping. The hot flash is the signal for you to go shopping. And who you're shopping for? A healthcare provider that you trust, that is specializing in treating women in menopause with compounded bioidentical hormones. You need that for the individualization. That's what a hot flash is for. That's my best take on what a hot flash is for. Don't stop until you get it right, or as right as you can.
Persistence pays off. It does. I'm absolute living proof of that. Took me a long time, but I'm living proof of it. You're absolutely right. Thank you for that answer, Dr. Rosensweet. V says, I've been very blessed then because I've had bad hot flashes for years, stopped with BHRT. That's a good positive way to look at it. And I love that.
Very blessed.
Yes, exactly. Many of us are very blessed, actually. So at least we can laugh about it, right? As we're sitting there just doing this in the middle of the afternoon or night, being wide awake, whatever. Okay, so on to 3, which is what you actually have been talking about, but I'm going to ask it anyway. Comes from Paige, and she says, I would love to hear Dr. Rosensweet speak especially, again, on anxiety, especially morning anxiety. It is so brutal in menopause. I'm working on positive affirmations. I'm working on myself, but I go into this fight or flight thing while I'm driving my son to school, and then I'm dealing with this for hours afterwards, and I just don't know what to do. So maybe the answer is still the same.
It's a nice short answer. Not.
That's why I asked it right at
Fasten your seatbelts, folks.
right. I've got mine right here. It's fastened.
All right, good.
Yeah.
That way you won't fly out of the seat when I give you this answer.
Can't give you a guarantee, but maybe.
Okay, maybe we'll. I'd like to see it happen. That'd be pretty entertaining, Carolyn.
Well,
Float it up. If you float it up.
weirder things have happened, have they not?
So, anxiety.
Ugh.
We are multi-dimensional beings, and anything that exists on any level simultaneously exists on every level. We have physical bodies. We have emotions. We have minds, thoughts. We have energy, just for openers. We exist on all those levels simultaneously. And anxiety, well, initially we could say, well, that's emotion. That's an emotion. Well, it's not really an emotion. Anxiety is what happens when you have an emotion, but you're partially repressing that emotion. So you come up with this vague sense, which is a 20th century word called anxiety. And inside anyone who's having anxiety, there are specific actual feelings, there's specific actual nameable emotions. So anyone's having anxiety that gets up close and personal with that anxiety will discover, oh, it's not anxiety. I'm having fear or sadness or anger or shame or guilt or emptiness or loneliness or meaninglessness or hopelessness. These are uncomfortable feelings. When you get anxiety, the feelings are rising to become to conscious awareness, and you've got mechanisms going on to repress them. So you sort of blur them out and you get these 20th century words called anxiety or depression. So that's what anxiety is. Now we're multidimensional, so anything that's taking place on any level is simultaneously taking place on every level. So on the biological level, there's certain chemicals and electrical phenomena that are measurable in someone who's having anxiety. For example, there's certain chemicals that take place in our body that are that if we were to take these chemicals from the outside, we'd have anxiety. Or if we were to deplete these chemicals in our body, we'd have anxiety. Because these chemicals are the chemical aspect of emotional well-being. There's a whole bunch of powerful chemicals that relate to emotional well-being, and we want to have the right amount of them. The most powerful chemicals in our body happen to be the hormones.
Mm.
So in order to have emotional well-being, we must have the right amount of chemicals and the balance of those chemicals. We must have the right amount of hormones. They relate to emotions greatly. So one way you can get someone into emotional trouble is deplete their hormones. I'm talking about all of them. And or the flip side of that is anyone who goes into hormonal depletion, the vast majority of them have mood consequences.
Mm.
These are the chemicals of your well-being. Yes, neurotransmitters count. They're chemicals that are present in our brain. They're not classified as hormones or steroid hormones. So a lot of people are familiar with serotonin, for example. It's a chemical that happens to have a high prevalence in our gut and our brain. And when people deplete their serotonin, they get anxiety or depression. So there's these serotonin selective uptake inhibitors that artificially boost up the serotonin, and they're antidepressants. So that's one way that you can address mood disorders, is increase the neurotransmitters. And I've actually done a lot of testing in that area, and people are, just like Prozac would tell us, a lot of people are depleted in their serotonin. But the elephant in the room are the hormones. And when a woman goes into menopause, for example, and she loses her hormones, mood disruptions is such a common symptom, including anxiety and depression. And as I mentioned earlier today, and have so many times, progesterone is the big calmer. So, what happens when you lose your progesterone? You get into a situation called anti calm. Anti calm is known as upset. You're going to stir up uncomfortable feelings. If you partially repress those feelings, those feelings are going to appear vague to you. They're not going to appear as the distinct fear or sadness or anger or shame or guilt that's actually coming to the surface. You're going to feel anxiety. So biologically, you can get anxiety, and as I was mentioning earlier, it can seem absolutely bizarre to a woman. She just doesn't even understand it. She's been strong. She's met life's challenges. Yes, she's stressed from time to time. She's had plenty of challenges. She's always risen to the occasion. She would never say that I've got a mood disorder. She would just say, hey, listen, if you're managing what I'm managing, you'd have feelings from time to time. That's one thing. But sometimes these very same women, they go into menopause and all of a sudden they're having anxiety, and they don't understand it because they're not used to something as vague as anxiety that's coming at them out of the blue, like this questioner. And I tell you, you lose your progesterone, you got a wonderful biochemical recipe to get anxiety. So when a perimenopausal woman or a woman in menopause has got anxiety, and yes, okay, you're feeling it in the morning when you're taking your kids to school, but the very first thing you do in a perimenopausal woman, no matter what symptoms she has, this is what we instruct our healthcare providers in our mastery program. When a woman of perimenopausal or menopausal age comes to you, and they've got quite a long list of symptoms, including some mood issues galore and many others, treat the menopause first and see what's left. And you're going to be shocked. So that's what I'm saying to you. Get that menopause treated first and see if that anxiety is still there. I'd be very surprised if you haven't had anxiety before in your life and you got anxiety now and you're in the perimenopause, you're in the menopause. Get thee to some progesterone. And the other hormones too, because estrogen deficiency can lead to a nice, wonderful anxiety. Because
wonderful.
Yeah, a nice, wonderful anxiety. a really high quality anxiety, when it's so stressful to a woman's body to not have sufficient estrogen that she's going to get hot flashes, as we were mentioning earlier. And this wonderful accoutrement of hot flashes are very stressful, is going to be the biology of the fight or flight response that includes adrenaline. And I can give anybody anxiety, just give them a little adrenaline. Just inject some adrenaline into them. And almost everyone will get anxiety. Is that a cup of adrenaline you're drinking?
It is a definite cup of adrenaline. I can have 1/2 of this and I'm good to go. I can't no more than that because I don't like that feeling.
Yeah, so caffeine can provoke, well, caffeine's got its own jittery effect. But so anxiety, perimenopause, the job always becomes the same. It always comes down to the same thing. Go shopping until you find a licensed healthcare provider who's focusing a lot of attention on treating women in menopause with compounded bioidentical hormones. And your job is to find someone you trust and you like, who's acquiring or has acquired certain expertise in treating women. And you'll figure it out. And mysteriously, there's a very high likelihood that anxiety will exist no more.
Which is probably about the most wonderful feeling. Well,
Yeah,
along with all the other wonderful
it
feelings we
is.
all have, but it's really nice to be anxiety free.
And let's take it back to that preceding question. That anxiety is occurring to you in the morning and it's getting you to do exactly what it's designed to do. It got you to ask the question, what in the heck is going on here? And again, the issue is it wants the right answer.
Right.
And the right answer, if you're in perimenopause, you want to start with the ovarian hormone replenishing. Don't go on these exotic, you know, antidepressants and anti-anxiety lytics and stuff like that. Don't go there. So many of you women, almost at the 90-95% level, I don't know what percent it is really, are going to watch that anxiety really diminish and disappear.
Ah, it's such a good feeling too.
And then there's this, not medicine is complex and we human beings are complex. In midlife, things tend to rise to the surface and become more conscious than ever before. You're younger, you're busy, you're working, you're taking care of your family, your kids, life, you got a lot of juice. And then along comes midlife, and if things are out of whack, they tend to come to the surface as never before. And things that you could avoid earlier on in your life, they'll rise. And sometimes that anxiety is a signal that, oh my God, I've got to speak up in my marriage. Or I want to talk to a therapist. This anxiety feels like it's got ancient roots. I want to talk to a professional who really knows how to help me unwind this. This is significant, and I'm glad to be taking it this far because this anxiety can be healed. And there are professionals that they've devoted their whole career to helping people who have fear and sadness and anger and shame and guilt and anxiety and loneliness and meaninglessness. And if you'll respect that the anxiety is there and you'll seek out one of these professionals, at some time you do the great work, and you're going to wind up in a better life. You're going to wind up happier and with more love and more fun. So sometimes that anxiety is pointing in the direction of there's something in my life that really matters to me. I want to figure out what it is. I'm even going to seek professional help. I'm going to go to Alcoholics Anonymous. I'm sure I can pronounce that, Alcoholics Anonymous. I'm going to go to AA. I'm going to go to some group therapy. I'm going to go to a therapist. I'm going to go to my local community center. I'm going to start talking to friends about this, because that anxiety can be the clue to something that's bothering you. And it could be ancient stuff that's bothering you. That if you just bring it up and you have some tools and some support, you'll heal it. I was talking to a 31-year-old young man who came to Earth very sensitive yesterday. He was very sensitive and very brilliant. And his sensitivity got him, almost forced him, because of the anxiety he was having, into early exploration of what are the emotions about? What is the mind about? And he sought help, and he's acquired tremendous skills to heal his emotions and his mind. And at the age 31, it was just so moving to me to see what new generation of young men are doing early on in their life. And he was mastering. And yet he told me he still had a considerable amount of anxiety. And I sat there at the table and I said, I'm going to do a prediction for you. I'm going to predict your future. I told him.
Did you have your tarot cards?
No, I just did it right out of my tuchus. I extracted it.
Your tuchus. I like that.
I said, I'm going to predict your future for you. You have had such courage and strength and willingness and vulnerability and openness to explore your own internal emotional and mental terrain, that there's going to come a time here that this is what you're going to notice. The anxiety that's dogged you all your life is going to become less and less and less, and it's going to go away, and it's not going to be there, and you're going to go, oh, I'm so thankful that I did my great work early in my life. So anxiety, like anything else in human life, it's significant, and there's a lot of ways to approach it. And we're living in an age
Ugh.
when there is so much information and tools and love and support. There's so many millions of Americans, so different than when I was a teenager. There's millions of Americans, by hook or by crook, have found their way to healing their emotions, their mind, and their life. Sometimes they break down from alcoholism, but they get the message of alcoholism, they break down, they admit it, and they get the help they need, and they transform their lives.
Right. It's
And
the
they're
why.
some of the kindest, most compassionate, most emotionally understanding folks on the planet, because they took themselves into it and they came out of it healed in so many ways. Not perfect, we're all works in progress. But so you always want to respect what's going on, and that anxiety that you experience could also be the key to the highway, that on the other side of doing the great work, getting the help, the support, the information and tools, getting so you can guide yourself a lot of the times. It's the key to your fun. It's the key to more love. It's the key to inner peace. It's the key to your freedom. It's amazing.
It absolutely can be. And it's an amazing thing of what you say and how you're able to turn it around into a positive. And that is so much the beauty of you, David Rosensweet, MD. Really, I know you've done a lot of the work, and I know a lot of us maybe are afraid, but anxiety can be positive and it can be poignant, correct?
Oh, yes.
So maybe all of us are feeling a little bit more relaxed now. Oh, my. Well, thank you for that answer. I'm going to keep my seatbelt on, though. I am. I'm not going to take it off. I'm going to move on to the next question, and I see all of your questions, everybody, and we'll certainly address them. I'm going to skip one and go to the next really quickly and come back to the other. My mother is 84 years old, Dr. Rosensweet. I've heard you speak before. She is totally incontinent, and she's in the early stages of dementia. And I am wondering if she would benefit from bioidentical hormones. And I thank you.
Well, it's certainly worth a try.
Mm-hmm.
And my beloved mother-in-law and her daughter is on our Facebook Live.
Yes, she is.
My beloved mother-in-law got low in hormones and the consequences thereof. And we treated her in her late 80s, and to advantage. She got a couple more years. And it certainly wasn't her mind. Her mind was as sharp as mine was. But it did relate to the muscle loss and the sarcopenia and the imbalance and the gait imbalance and the falling. And so it was very impressive. And I mean, there was a point where dearest Mary was walking with a walker, and she was in her kitchen, and she couldn't stand up in the kitchen stably. And when she just turned, she fell because she lost her muscle. That's what happens when you don't have androgens. You lose your muscle. She fractured. She was in rehab for 3 months. She came out of rehab. We treated her with androgens, with testosterone. And we have an actual video in our archives of her sitting on a low couch with her arms outstretched, with this huge smile on her face, as was her nature. And she stands up from a low couch not using her hands. That's why she had her hands up in the air. And so, can the elderly benefit? Well, you always give it a try. I tried the same with my own mother, and she wouldn't let me treat her until she was in her late 80s. And there was some gain. It wasn't perfect, but we've even developed a formula in the menopause method for treating the elderly, because it's a little more challenging for them to comply, especially when there's a cognitive issue. And I'll tell you, when there's a cognitive issue in a woman, we push that estrogen even if her period comes back. That's a rare exception. We never want to give women that much estrogen. They don't need that much estrogen. There's risk with that much estrogen, but I'll tell you, when cognition is at stake, we do what it takes. And if it takes supercharged levels of estrogen, when cognition is at stake, i.e. dementia, how much can you gain?
Right.
Well, you try, you push it. It's much better to catch a younger woman as she's getting a cognitive blur or cognitive challenges. It's much better. And I've told this story, and I'm going to tell it again, that I was about to testify in front of the National Academy of Science Committee on Bioidentical Hormones. I had done research on the other physicians that were on the panel that I was on, and I learned that one of them was on a certain protocol that tends to bring the period back. And traditional physicians who don't have full understanding about menopause and hormones have a bug in their butt about this particular protocol, getting a woman to have a period keep going. So the coffee break is ending. I'm seated in my seat. Wanda is sitting down, this medical doctor from Washington, D.C., and she's smiling at me and introduces herself. And I didn't even say my name. I said, with a big smile, are you going to tell them what kind of protocol you're actually on? And she winked at me and she said no, because she was aware that it was a bugaboo for these folks.
Right.
She and I and her son went out to lunch, and I heard this story. She was 55, a practicing physician. She was starting to have cognitive challenges. She wasn't thinking clearly. And she had known about the relationship of estrogen to cognition. And her mother had dementia, and her mother's sister, thus her aunt, had dementia. And so she was really scared. She thought she was going to have to stop practicing medicine. So she kept taking estrogen, and she kept on increasing the dosage, and her mind cleared up. And I was sitting there 10 years after the cognitive challenge occurred. She was 65, and she was as clear as a bell. So I'm saying this because I can in no way know whether your relative will have any benefit at this point, but they may, and it's sure worth a try from my perspective, even if you got a little bit back, because in women, there can be a small, medium, large, or huge relationship of dementia to estrogen deficiency.
Yes.
There's other causes of dementia. There's a great book out there by Dr. Bredesen, which relates to Alzheimer's, the end of Alzheimer's. And it speaks to the many moving parts. But in women, the most common thing is insufficient estrogen. And man, I tell you, you push it. You push it. Even if your period comes back, you push it to where you see if you can alleviate that dementia. Now, you are dealing with your mom, who's quite a bit older, so can't say that we're not guaranteeing anything, but worth a try.
Yes. Thank you so much. It kind of makes me sad with the if onlys from back in my day, taking care of some people that I did. Whew, okay. Kind of switching gears here, and we'll end out, I guess, in this. Thank you, Kim, for saying thank you. But Tiffany actually asks, before I go to this one, she says, is it the same with men?
Well,
yeah, right.
Can men lose
it? Yeah, can men lose it?
No, it's never happened. No, I think that's the wrong answer.
At least not in the Rosensweet men
Let's
family.
let's interview women and ask them, can men lose it?
Right. I think we'll have a collective yes in there.
And at what age do they lose it? Well, of course, all of us, we're human and we face many challenges. And so I'm not going to go into this one. But
Got it.
men can lose so much stuff, and muscles, heart, arteries, cognition, bladder control, all kinds of things. Canes, walkers, wheelchairs, adult diapers. Hormones are the most powerful biochemicals in our body, and they relate to so many functions. It's off the charts. I mean, even in COVID, women do better with COVID because of the estrogen they have. Estrogen relates to the immune system, as does testosterone. Testosterone is energizing. Yeah, want to help somebody with their illness? Give them more energy. Their body knows what to do with it. Their body knows how to heal. But I'm not going to dive deeper into that other than, oh yeah, lots of stuff happened to men. What's the moral? Take care of yourself. Do lots of good things for your health. And men, replenish your hormones. Here's mine. This is one of the moving parts, my testosterone. It's one of the moving parts that I do.
It's like mine. We are human, men and women, and yeah, hormones. We have a couple of minutes left, and so I'm wondering how you feel about someone's using over-the-counter DHEA to naturally help aid her taking testosterone. This has been suggested to this woman by her doctor before being put onto testosterone. Is this something that you would feel is necessary to do?
Well, if that was the only tool in the entire world I had, I'd say okay, reluctant, okay. But we do 24-hour urine hormone testing on women, and we know what happens. And DHEA would be the last thing that I would address. The estrogens deplete. The progesterone depletes. The progesterone can deplete earlier and deeper than the estrogens do. The testosterone depletes. DHEA is a prohormone. It's what it does is it converts to estrogen or testosterone. We don't have any control over that conversion. I mean, cholesterol converts to hormones eventually. Why don't we eat butter and everything will be fine? No, we don't feed someone butter. We don't have any control of how and to what extent it's going to convert to ovarian hormones.
Right.
We always treat with the end hormones. So the thing that matters to me is getting the testosterone, the estrogen, and the progesterone right. And do we also treat with DHEA? Yeah, in conjunction with the others we do. Because the DHEA levels we want when we ultimately do a 24-hour urine hormone test on a woman, and we're going to do it maybe 2 to 5 months into her process, usually when she says, hey, I feel better, we're going to, if we haven't treated her with DHEA, we're going to see low DHEA levels. Well, we like to copy nature. We don't have to restore youthful levels of DHEA, but we want to get the estrogen, progesterone, testosterone, and DHEA in a reasonable range. We know what those ranges are. So we go for all of them, but I would never start with DHEA. So I'm concerned that the person who is treating her, with all due respect, because I know doctors care for the most part, absolutely, I would say it's time for that physician to take on the specialization and getting really excellent, because I would never start with DHEA.
Right.
You have no way of predicting whether it's going to become testosterone or whether it's going to become estrogen. and you're not addressing the progesterone. And if you're doing 24-hour urine hormone testing after giving DHA, well, you'll find out, and that's reasonable, but there's very few people doing that. So I'm assuming that that's not taking place. And, oh my God.
Again, say it's not so. Say
It's
it's not
so.
so. Oh, it's so?
It's so.
I see that. I think you're going to turn into a pumpkin. So, it's where I am. It is 8 o'clock. We must say goodbye. However, we have some amazing questions, and I'll be busy at work with those. Dr. Rosensweet, always thank you so, so much for amazing answers.
You're entirely welcome. It's always a pleasure, Carolyn.
Thank you so much. So we're going to say goodbye to everybody. We're up and around. I'm going to put iwonderdoctor.com up there. Take a look at those fabulous, fabulous little segment interviews. Amazing. I'm wishing you a fabulous day. Everybody a fabulous day. And we will see you on Thursday.
We sure will. Good to see you, Carolyn. Goodbye, everybody.
Bye-bye, everybody.